Developing a score chart to improve risk stratification of patients with colorectal adenoma. Introduction. Colorectal cancer, CRC, is one of the leading causes of cancer-related death in the Western world. Detecting and removing early-stage cancers and precursor lesions, adenomas, reduces CRC incidence and mortality. Individuals in whom adenomas are detected have an increased risk of developing CRC compared with the average population, even after adenomas have been removed. Patients with adenoma are therefore recommended to undergo regular surveillance colonoscopy after polypectomy. Surveillance colonoscopy presents a considerable burden for individuals as well as demand on endoscopy units. Surveillance colonoscopies are estimated to constitute 13% to 40% of all colonoscopies performed. Improved risk stratification of patients with adenoma can increase efficiency because it would target surveillance colonoscopy more accurately to those patients who are most likely to benefit from the procedure. Currently, risk stratification of patients in post-polypectomy surveillance guidelines is predominantly based on adenoma multiplicity and categorization of an adenoma as advanced or non-advanced. The definition of an advanced adenoma is an adenoma with at least one of the following characteristics: size greater than or equal to 10 millimeters, high-grade dysplasia, HGD, or villous histology. Generally, guidelines do not incorporate a higher risk level for patients in whom multiple risk factors, e.g. large adenoma size and villous histology, are present, despite studies showing that each factor is an independent predictor of advanced adenoma recurrence. Furthermore, several additional predictors for recurrent advanced colorectal neoplasia, such as older age, male sex, and proximal location of the adenoma, are generally not considered at all. Including predictors into a scoring system could result in a more accurate risk stratification of patients with adenoma and may improve efficiency of post-polypectomy surveillance. The aims of the current large community-based study were 1. To develop a valid scoring system for risk stratification of patients with adenomas based on independent predictors of advanced colorectal neoplasia, ACN, and 2. To compare the score model to risk stratifications used in current post-polypectomy guidelines. Background and study aims. Current surveillance guidelines risk stratify patients with adenoma by using only one or two factors: adenoma multiplicity or presence of an advanced adenoma characteristic. Combinations of adenoma characteristics are not considered, which limits the predictive value of these guidelines. The aim of the study was to develop a scoring system for more refined risk stratification of patients with adenoma. Patients and methods. The Dutch Pathology Registry, PALGA, was used to identify newly diagnosed patients with adenoma in 10 Dutch hospitals between 1988 and 2002. Medical records were reviewed until 1 December 2008 for follow-up. Logistic regression analysis was used to assess patient and adenoma-related predictors of metachronous advanced neoplasia. The prediction model was validated by bootstrapping and cross-validation. A score chart was developed based on identified adenoma-related predictors. The discriminative ability of the prediction model was compared with currently used risk stratifications in surveillance guidelines. Results. A total of 2,914 patients with adenoma were included. Mean age 61 years, 55% male. The score chart consisted of characteristics that contributed 1 point: size greater than or equal to 10 millimeters, villous histology, proximal location, having 2 to 4 adenomas, or 2 points, having greater than or equal to 5 adenomas. A patient's adenoma risk score could range from 0 to 5 points. A score of 5 for a 75-year-old man implied a 5-year risk of advanced neoplasia of 46%. The discriminative ability of the model was moderate, C statistic 0.712, but better than risk stratifications in current international guidelines, which had C statistics of 0.642 to 0.674. Conclusion. A score chart that combines adenoma-related predictors of advanced colorectal neoplasia optimized the risk stratification of patients with adenoma for appropriate surveillance colonoscopy intervals.